Hi everyone. Although I am not a gynecologist, I am often getting a lot of patients with subfertility issues, mostly for the fertility counseling. Some of these patients are having subfertility issues for 3 to 5 years duration, or some patients have even more duration of subfertility, like 5 to 10 years. Some of they have underwent a lot of fertility interventions like intrauterine insemination, ovulation induction, and furthermore. So, seeing hundreds of these patients, I have developed my own formula called CTT. This formula has given higher chance of my patient to get pregnant. Usually, most of the patients get 50% success in their pregnancy in 3 months duration, and patient who had complicated issues also had some chance of getting pregnant, like 20%. So, if you follow this CTT formula, you will have higher chance of getting pregnant. Today, I am going to relieve you this secret formula to get you pregnant fast. I am Dr. Sanjay, general practitioner and health educator. Also, I am very happy to respond to your comment. So, please share your issues and ideas on my channel, and also make sure that you are subscribing my channel so that you get all my future updates. In one of my last YouTube short, I mentioned that most important thing to get pregnant is having sexual intercourse, but it is consistent, well timed and technically correct sexual intercourse to get you pregnant fast. So, my CTT formula stands for these 3 concepts, that is consistency of sexual intercourse, well timing of sexual intercourse, and proper techniques of sexual intercourse. So, now we are going to discuss all these 3 in my video. When we are talking about the increasing the chance of getting pregnant, it is very important to increase the frequency of sexual intercourse. So, you might not believe that there are some patients who don't have adequate amount of sexual intercourse and even expecting they getting pregnant. Usually, some of these patients are not having sexual intercourse at least 3 to 4 times a month. So, this is not adequate and they are having very less chance of getting pregnant. In recent research, they say if you are having every other day sex during fertile period, there is a 33% of chance of you getting pregnant. And also, if you are having sexual intercourse every day during this fertile period, it will increase your chance of getting pregnancy to 36%. So, whenever you increase the chance frequency of your sexual intercourse, there is a higher chance of you getting pregnant. But make sure that you are having adequate amount of sperm count, sperm volume and sperm motility to make the egg fertile. Timing of sexual intercourse is the next most important to make you pregnant fast. So, we will imagine that you are having sexual intercourse randomly around 5 times a month. So, you are having 5 times or 5% or even less chance of getting pregnant. But if you are focused your 5 times sex during fertility window or fertile period, there is a high chance of you getting pregnant, around 33%. So, here what you have changed is timing of your sexual intercourse. So, if you need to increase your chance of getting pregnant, you have to focus your sexual intercourse during fertile window. So, what is fertile window fertility period? So, usually in a patient with a regular 28-day cycle, fertility window or fertile period would be 9th day to 15th day of your menstrual cycle. So, we will discuss about this fertility window in one of our future video. Third most important thing to make you pregnant fast is the proper techniques of your sexual intercourse. As same as the consistency and timing, proper techniques are very important thing to make you pregnant fast. So, whenever I am doing a fertility counseling, I am focusing on the techniques of your sexual intercourse a lot. Usually there are a lot of sensitive things I am discussing, and I want to discuss these things in a very deep manner. The first question I ask is, when are you having your sexual intercourse? Usually we recommend that you have to have a sexual intercourse in a very relaxed environment. Usually it's after good sleep and after good rest. So early morning sex is the most important thing. But it's okay, you are having your sex even during daytime or even during night. If you are not that under stress and you are having adequate amount of rest before your sexual intercourse. Then I am asking about the use of lubricants, because most of the people now get used to have these lubricants during their sexual intercourse, but it is not a necessary thing during sexual intercourse. So I am not recommending you to have lubricants if you are waiting for a pregnancy. But still, if your lady is having some conditions like vaginismus, there you have to have lubricants so that facilitate your sexual intercourse without much interruption and much stress. So when you are using lubricant, you have to make sure that it is not a spermicidal lubricant, and also it doesn't make your sperms motility reduce. So whenever you are using lubricant, make sure that it fulfill all these criteria. Then again, the position of your sexual intercourse is very important. Even though there are a lot of controversy and lot of discussions on position of your sexual intercourse, I have a different opinion, because most of the fertility experts say it's okay, you are having sexual intercourse whatever the position you like. But my opinion is that you should have sexual intercourse in a deep penetrating method, because it will facilitate your sperms to go deep into your reproductive tract. So it not necessarily be a missionary position, but also you can use some other alternative positions like doggy style and so much more. Then again, there is some discussions whether you need to have a lie on the bed for few minutes after sexual intercourse. Usually fertility experts say it is not necessary, you have to be in the bed, but I recommend that you have to stay for a few minutes and have some relaxation to facilitate your sperms to go into a deep part of your reproductive tract. When we are talking about techniques of your sexual intercourse, one of the biggest mistake you do is the washing of your vaginal tract. Usually some people washes their vaginal tract so that improve the hygiene of their vagina, but still when they are washing their vaginal tract, the sperms would be washed out from the vaginal tract. Additionally, one of the most problematic thing is washing the vaginal tract with some soaps. When you are using soap, the pH of your vaginal tract will be changed, and these changes of your pH will be damage your sperms. So the chances of you getting pregnant will be reduced a lot because of this use of soap soon after sexual intercourse. Finally, I will recommend all of you to follow my 3 secret ways of make you pregnant. That is consistency of sexual intercourse, timing of sexual intercourse, and techniques of sexual intercourse. As I mentioned, these 3 techniques has improved the chances of my patients getting pregnant a lot. So this will help you all to get pregnant fast. Thank you very much.